If you smoke or if your partner smokes, you need to hear this. Smoking doesn't just destroy your lungs and heart, it's actively killing your ability to have sex, killing your sperm, increasing your risk of bladder and kidney cancers, and causing problems most men are too embarrassed to talk about. Today, I am going to show you exactly what smoking does to your penis, your fertility, and your urological health. I am Dr. Maulesh Tolakia, a senior urologist and andrologist. A 40-year-old man, let's call him Vikram, came to my clinic with his wife. They had been trying to conceive for 3 years but with no success. His wife had been tested and everything was normal. But Vikram, he was a smoker, had been since college, 4 to 5 cigarettes a day for last 12 years. We did a semen analysis. His sperm count was 40% lower than normal. His motility, how well the sperm swim, was terrible. And his sperm DNA fragmentation was very high, meaning damaged sperm. Everyone knows smoking is bad, but most men have no idea what it's doing to their manhood, their fertility, and their ability to perform. Today, I am going to tell you Vikram's story and break down exactly what smoking does to your urological health. Quick question: are you a smoker, an ex-smoker, or have you ever smoked? Drop current, ex, or never in the comments. And if you are trying to quit, write trying. Let's see where everyone is at. No judgment, just honest conversation. Let's start with the big picture. When you smoke, you are inhaling over 7,000 chemicals. Many are toxic, some are carcinogenic. And these chemicals don't just stay in your lungs. They enter your bloodstream and affect every organ in your body. In urology, smoking specifically damages blood vessels in the penis, which can lead to erectile dysfunction, sperm production and quality, leading to infertility, bladder lining, causing bladder cancer risk, kidney functions, which can cause kidney cancer, and of course, urinary flow, which can worsen the prostate symptoms. So, this isn't just about your lungs or your heart. Smoking is attacking your sexual function, your fertility, and dramatically increasing your cancer risk. Let's break down each one. Number 1, smoking. Let's start with the one that kills. Smoking is the single biggest risk factor for bladder cancer. If you smoke, you are 4 times more likely to develop bladder cancer than a non-smoker. Why? The toxic chemicals from cigarette smoke get filtered by your kidneys and stored in your bladder. Every time you pee, your bladder lining is bathing in carcinogens, literally marinating in cancer for hours. Early bladder cancer has a 90% survival rate, but most smokers ignore the early warning sign, blood in the urine, thinking it's just a UTI or a kidney stone. By the time they see a doctor, it's often advanced. If you smoke and you even see a tiny bit of blood in your urine, even once, see a urologist immediately. Don't wait. Don't chat GPT. Get it checked. Now let's talk about what brings most men to see me, erectile dysfunction. If you smoke, you are twice as likely to have ED compared to non-smokers. And the more you smoke, the worse it gets. Erections are all about blood flow. When you are aroused, blood rushes into the penis, fills the spongy tissue, and creates hardness. But smoking does 3 things that destroys this process. Number 1, narrows the blood vessels. Nicotine and other chemicals causes vasoconstriction. Your blood vessels get narrow. The arteries in your penis are tiny, 1 to 2 millimeters. When they get narrow, even slightly, the blood flow drops. Less blood, softer erections or no erections at all. Number 2, damages the endothelium. The endothelium is the inner lining of your blood vessels. Smoking damages this lining, reducing nitric oxide production. Nitric oxide is what signals your blood vessels to relax and let the blood flow in. Without it, you can't get hard, even if you're aroused. Think of it like this. Your penis needs open highways for blood to rush in. Smoking turns those highways into narrow, damaged service roads. Traffic can't flow. Number 3, accelerates atherosclerosis. Smoking increases plaque buildup in arteries, atherosclerosis. The same process that causes heart attacks also blocks the arteries to your penis. In fact, ED is often the first warning sign of heart disease. So if you are a smoker in your 30s or 40s and you are already having erectile problems, your heart is likely to be next. This is your body screaming at you to stop. Vikram told me he had been having trouble for about a year. He thought it was stress or work pressure, so he tried Viagra. It helped a little, but not much. What he didn't realize, smoking was killing his blood vessels faster than the pill could compensate. The good news, blood vessel damage from smoking can reverse if you quit early enough. Vikram quit smoking completely. 6 months later, his erections improved significantly. Not perfect, but much better. And no more pills needed. If you are trying to have a baby and you smoke, listen carefully. Smoking attacks your fertility in multiple ways. It lowers the sperm count. Multiple studies have shown that smokers have 15 to 20% lower sperm count on average compared to non-smokers. Heavy smokers, more than pack a day, can see drops of 40% or more. Remember Vikram, his count was 40% below normal. For context, normal is 15 million sperms per milliliter. His was 9 million. That's a huge difference when you are trying to conceive. Number 2, reduces the sperm motility. Motility is how well sperm swim. If they can't swim properly, they can't reach the egg. Smoking damages the mitochondria in sperm, their energy source. Result, sluggish, weak sperm that can't make the journey. Number 3, damages the sperm DNA. This is the scariest one. Smoking causes oxidative stress, which damages sperm DNA. Even if fertilization happens, damaged DNA increases the risk of miscarriage, birth defects, and developmental issues in the child. So, it's not just about getting pregnant, it's about having a healthy pregnancy and a healthy baby. Damaged sperm puts your future child at risk. Number 4, lowers the testosterone. Chronic smoking can reduce the testosterone levels, which affects sperm production. Lower testosterone is equal to lower sperm count, which can lead to lower fertility. Here's the good news. Sperm regenerates every 74 days. That's about 2.5 months. If you quit smoking today, in 3 months, you will have a completely new batch of sperm. Healthier, stronger, with better DNA. Vikram quit smoking. We rechecked his semen analysis after 4 months. His count improved by 35%. His motility went from 30% to 55%. His DNA fragmentation dropped significantly. And 7 months after quitting, his wife got pregnant. They have a healthy baby boy now. He told me, "Doctor, I wasted 2 years of our lives smoking. If I had known this earlier, I would have quit the day we decided to start a family." Other ways smoking harms your urological health beyond ED, cancer, and fertility. Smoking also worsens BPH symptoms. If you have an enlarged prostate, smoking makes urinary symptoms worse, weaks the stream, more frequent urination, and incomplete emptying. Smoking increases kidney cancer risk. Smokers are twice as likely to develop kidney cancer. The toxins damage kidney cells over time. Smoking causes chronic inflammation. Smoking keeps your entire urinary system in a state of chronic low-grade inflammation, increasing infection risk and tissue damage. Smoking also reduces the surgical outcomes. If you need any urological surgery, maybe for prostate, kidney, bladder, smoking dramatically increases the complication, delays the wound healing, and worsens the outcomes. Look, I am not here to lecture you or make you feel guilty. You already know smoking is bad. What I want you to understand is this: the damage smoking does to your sexual health, your fertility, and your cancer risk is real, measurable, and happening right now. But here's the flip side. A lot of this damage is reversible if you quit early enough. Timeline of recovery after quitting: 2 weeks to 3 months. Circulation improves and erectile function starts recovering. At 3 months, sperm quality begins improving significantly. At 1 year, excess heart disease risk drops by 50%. At 5 years, bladder cancer risk drops by 50%. At 10 years, lung cancer risk drops by 50%, and most smoking related damage is significantly reversed. If you are a smoker and watching this, I'm not going to tell you to quit. You already know you should. What I will tell you is this: every day you delay is another day of damage to your penis, your sperm, your bladder, and your kidneys. The damage is real, but so is your ability to reverse it. If this video helped you, hit that like button and subscribe. Share it with someone who needs to see it, a friend, a partner, a family member. And tell me in the comments, are you ready to quit or have you already quit? Share your story. It might inspire someone else.